H1N1 cases continues to rise in the Cayman Islands. The increase isn't surprising to health officials, since the percentages are pretty much on line with the rest of the world. To help combat the virus, the Pan American Health Organization visited the HSA.
PAHO has been setting the guidelines, helping countries to develop their guidelines and the standards and norm for treatment, and has also been helping them in monitoring the incidence of H1N1 cases in the region. We've also been working with each country to ensure that the supplies, the medicines, and also the laboratory supplies are in place. I would like to first start out by saying that I think after our evaluation yesterday that Cayman has been doing very, very well. And part of my visit was to look at the surveillance system, to look at the increase in cases that you've been seeing, and whether the systems are in place. And I should emphasize that I think the health team and the ministry has been doing an excellent job. There are certain very minor areas that we can strengthen, and so that's what we've been working on.
Glad to hear Dr. Pate say that what we've done so far is good. I think that we are ready. Our plan is shown up to this date that is a good plan. I think we are ready for a more severe strain should it happen.
The current strategy for the novel H1N1 is different now than it was when the pandemic first started. Initially, we were trying to establish that there was a local presence here on the island, so we were looking for that first index case to try to contain that first person to prevent its transmission. However, since that time, we now have local presence of the H1N1, so our strategy is to try to minimize the impact here in the islands. As this flu progresses, we will be changing our strategies accordingly.
If you feel like that you're just getting, you feel like you're getting the flu, you're not very febrile, you feel the usual malaise, joint pains, etc., and you're coughing, of course, what we suggest you do is stay home, practice personal hygiene, and also stay as far as you can from other persons. Why? Because whatever you have, it might not be the H1N1. Might just be the seasonal flu, but certainly you don't want to give it to somebody else. If you are febrile and you really feel ill, you should seek medical attention. Persons who should come in are persons at the extremes of ages, meaning very young and very old, as well as if you're pregnant, if you have an underlying chronic condition, you may be diabetic, if you have a malignancy, if you are immunocompromised in any way.
The hospital is prepared for any sort of severe illness that we can actually minimize the transmission when those patients are admitted. As this disease progresses and we have larger numbers, obviously what we need to do continuously is to educate the public how they can minimize the impact and how they can prevent transmission.
The person out there in the general population needs to look at their hygiene. That's the most effective means. Good hand washing. When you have flu-like illness, you need to ensure that you don't blow the nose and spread the virus, but that you use tissues, you dispose of this properly, that there's appropriate hand washing, you isolate yourself. But if you are ill and you're showing up with symptoms that are not resolving, you do need to visit your physician. Tamiflu should only be used in cases of severe illness. It is not a medication that should be prescribed for very mild symptoms, and it should not be used if you are thinking of traveling to an area where there is H1N1. Certainly, totally contraindicated. We should not, and I'd like to stress that we should not use Tamiflu as a prophylaxis for just normal travel. It is the only medication to which there is a sensitivity of the H1N1 virus, and so we need to ensure that it is used appropriately.
If you have severe symptoms, before you enter the accident emergency room, make a stop here at this station. Use the sanitizer, make sure you get it in between your fingers, and also grab one of these masks. For more information, please contact the Public Health Department at 244-2621 or the flu hotline at 926-2812.